Thank you, everyone. Thank you for inviting me here this afternoon. The title of my presentation is Engaging Refugees and Asylum Seekers in Mental Health Treatment and Exploring the Role of Cultural Brokers. Before I begin, I just wanted to give a shout out to the collaborators that I've worked with over the past couple of years. Doctors Ifra Magan, as well as Michelle Munsing, as well as my RA that I worked with, Lexia Reed, and my collaborator, Mohamad Abdirahman. So that being said, I just wanted to put a little bit of context and background to the research. Currently, there are over 120 million people who have been forcibly displaced worldwide, and we are currently experiencing a global humanitarian crisis, and this number is expected to rise more. Refugees and asylum seekers do face higher rates of psychological distress, and this is in part due to the stressors of the stress and that they've experienced throughout their migration journey, as well as the stressors that they experience once they adjust to a new country as well. This being said, this has contributed to the high risk of long-term mental health issues after resettlement here in the United States, and they are less likely to seek treatment than compared to the general population. So this is what we call a mental health treatment gap. And so what I've been trying to look at over the past couple of years in this specific study was the first, just to kind of figure out how mental health symptoms manifest. And the second one is to identify certain barriers and facilitators to mental health treatment, and to really figure out the role of cultural brokers in engaging refugees in mental health. And before I go any further, I just wanted to provide a brief definition of what a cultural broker is. So a cultural broker is an individual, and this individual shares both the U.S. culture as well as the refugee culture to help those, and in this case, refugees and asylum seeker, participate in certain mainstream activities. So in this case, would be engaging in the mental health treatments here in the United States. And so for the study that I completed, I completed 15 qualitative in-depth interviews via Zoom, which included 10 cultural brokers as well as 5 key stakeholders. And these key stakeholders include community leaders, refugee mental health manager, as well as field experts as well. And the inclusion criteria included those who have lived in the United States for at least 5 years and who have been working as a behavioral health service provider for at least 1 year. And participants originated from a wide range of countries, including Bhutan, Somalia, North Africa, Iraq, Sudan, and Rwanda, and on average have about 11 years of behavioral health, being in the behavioral health field. And throughout the in-depth interviews, I did a purposive sampling of refugee behavioral health providers in refugee communities and organizations in the northeastern United States. And the interviews were professionally transcribed through audio recording, through line-by-line open coding, and using grounded theory techniques that led to develop a project codebook. And so the three emerging themes that really were highlighted from the interviews that I completed were, the first one was refugee psychological distress is really a culmination of the multiple displacement stressors that folks experience when they arrive here into the United States. And throughout, or for searching for wellness, refugees and asylum-seekers experience a lot of barriers to care, but also have facilitators that help them out as well. And the third one is cultural brokers as this bridge towards healing. And so in terms of this whole sense of psychological distress, refugees manifest a range of psychological distress, which includes anxiety, depression, trauma, psychosis, somatic symptoms, and substance use, which is really a culmination of both the pre-migration stressors, such as experiencing grief and trauma of leaving home or being forced to leave at home, exposure to violence, persecution, basic needs not being met. In addition to when they arrive here, some of the post-migration stressors, such as experiencing culture shock, employment and financial stress, language barriers, and also being forced to rely on others. And so being displaced and resettling in the United States is a traumatic and stressful experience. And not a single stressor contributes to this distress, but it's really a culmination or this domino effect of multiple stressors over many years. And participants who I interviewed as well, they also reported that refugees and asylum seekers seek a wide range of ways to manage their mental health symptoms, and that before seeking quote-unquote formal mental health treatment, they also do many things to manage their mental health symptoms. So those includes hoping the symptoms would subside on their own, managing the symptoms within their own family, seeking cultural, traditional, and religious forms of healing, which is a big component. And some of the barriers to care includes transportation, having to wait for services, financial related issues, but the barrier that was mentioned over and over was this large role that mental health stigma had. But there was also many facilitators of care who also help refugees and asylum seekers get the help or connect with mental health treatment, which includes providers who speak the language, supportive family or community members, as well as cultural brokers. And last but not least, the third emerging theme was this whole sense of cultural brokers as this bridge towards healing. So they provided a variety of services to refugees, and the specifics are more on advocating. So advocating for the refugees that they worked with, connecting to resources, expanding on their social network. Psychoeducation was a big part of this, and this bridge between providers. And some of the characteristics of what makes a cultural broker really effective were this whole sense of being able to develop trust, rapport, having a shared language, having a shared culture as well, this knowledge of what mental health is, and this familiarity with the U.S. culture, this refugee experience and just being a role model as well. And so what I found through the interviews that I conducted was that displacement itself is linked to a wide range of pre- and post-migration stressors, which all contribute to mental health symptoms. And that when seeking help for these symptoms, there are a wide range of barriers that, such as stigma, fear, and lack of trust, language barriers, which are likely to contribute to the low engagement rates among some refugees and asylum seekers. But that also future research should really explore the potential of using cultural brokers as a form of intervention to really improve refugee mental health access and outcomes. And so cultural brokers can really encourage mental health treatment seeking among refugees. Thank you.